Hey, Doctor. You wrote a little bit about how that you're involved with the committee on advising the NFL and just how to proceed going forward. Just curious, what is your take about how, you feel like that the NFL should proceed, when you think it would be safe for everyone to get back, and, do you think you're going to be able to play a full season?
Well, you know what? For me, I see that more as a privilege to be able to sit on that committee, the task force from the NFLPA. And there's many committee that both the NFLPA and the NFL has put in place in order to kind of evaluate what's going on, and I'm not an expert, I'm sitting on that call. There's people from like Stanford, Harvard that study epidemiology and public health. So I'm there to learn and maybe give a little bit of my perspective as a player, but I don't want to comment on what's going to happen. For sure, there's plenty of scenario right now, plenty of different strategy in place, and it's going to be interesting to see how that's going to play out. And I think that the number one thing is for sure to keep the players safe, but I think the NFL in general has also a responsibility towards the community and their fans. So making sure that we're not becoming like a vector of propagation for that virus. So there's a lot of question, and like I said, it's going to be interesting to see how that's going to evolve in the next few weeks, months.
All right, let's go to Adam Teicher. Go ahead, Adam.
Hey, Larry, I hope you're doing well up there. I wanted to ask you if you could maybe detail in brief what exactly you're doing there, and also how do you justify the tremendous personal risk you're taking here by doing this?
Yeah, I mean, it's right now I'm working quote unquote as an orderly. It was kind of the easiest status to give me because I'm kind of in a gray zone, having graduated with my doctorate in medicine, but I'm not in a residency program. So it was kind of hard to be like, I jump in as a physician because I'm not really at this specific time. So the help that the healthcare department needed was mostly as orderly. So that's what I'm doing. But I'm doing also a little bit of nurse tasks, handing out medication, making sure the patient are all right. I'm working in a long-term care facility right now. So, the average patient is probably like closer to 80 years old. So it's a totally different mindset. I haven't really been exposed to a lot of geriatric patients throughout my medical studies. So it's really a different mindset. And in that time of crisis, there's just so many extra step you got to do, in order to protect yourself, but also protect your patient. So, we're wearing like our visor and our mask, like all day long during the whole shift, washing your hands. And there's just so many precautionary measures in place in order to protect both you and the patient, that it just make everything heavier in terms of task. And that's why they need so many people. Yes, there's a lot of medical professionals that have been sick from COVID or are in quarantine right now, but there's also just more work to do on every floor. So that's why they need people, and that's why I'm here right now.